Hello, everyone. Welcome back to Kraus TBI podcast video. I'm Dr. Gary Kraus, a neurosurgeon with Kraus TBI Pain and Spine Institute in Houston, Texas. I'm pleased to have you here and to be part of this amazing community we're building together. Today, we have a really important topic to discuss: PTSD, or post-traumatic stress disorder. It's a subject that's close to many of our hearts, and it's so crucial that we talk about it openly and support one another. So grab a cup of tea or coffee, and let's dive into today's topic. In a world where many battles are fought silently and invisibly, post-traumatic stress disorder, PTSD, remains a profoundly misunderstood mental health condition. Developed after experiencing or witnessing a traumatic event, PTSD is often associated with soldiers returning for war. However, it can affect anyone, regardless of age or background, following a traumatic event. PTSD, or post-traumatic stress disorder, is a mental health condition that can develop after exposure to a traumatic event. It's often associated with the military combat or violent assaults, but it can occur from a wide variety of traumatic experiences, including traumatic brain injuries, or TBIs. A traumatic brain injury occurs when an external force, such as a blow or jolt to the head, or an acceleration-deceleration injury to the brain, causes dysfunction. This can result from a fall, a car accident, or being struck on the head. Individuals who've experienced a TBI may develop symptoms of PTSD as a response to the trauma associated with the injury. For example, someone who suffered a TBI in a car accident may develop PTSD symptoms such as flashbacks, nightmares, or severe anxiety when they're reminded of the accident. However, PTSD can also develop from other traumatic aspects of life that do not involve physical injury. These can include experiences such as witnessing violence, experiencing natural disasters, being a victim of abuse, or losing a loved one. Essentially, any event that is perceived as life-threatening or severely compromises the emotional well-being of an individual can lead to the development of PTSD. And it's important to recognize that PTSD is not solely the domain of physical trauma or injury. The emotional and psychological impact of any traumatic event can lead to the development of PTSD. And it's crucial to seek help and support if you or someone you know is experiencing symptoms. PTSD is a mental health condition triggered by a terrifying event, either experiencing it or witnessing it. The symptoms may include flashbacks, nightmares, and severe anxiety, along with uncontrollable thoughts about the event. It is commonly associated with soldiers returning for war, but the reality is that anyone can develop PTSD at any age following any type of traumatic event. Despite its prevalence, there is a lot of misinformation and stigma surrounding PTSD, which makes it difficult for those affected to seek help. The hidden nature of PTSD leaves many feeling isolated and misunderstood, further compounded by the misinformation and stigma surrounding it. It is not a sign of weakness, nor can it be overcome with willpower alone. This misunderstanding can make it incredibly difficult for those suffering from PTSD to seek help they need and deserve. One key treatment for PTSD is eye movement desensitization and reprocessing, EMDR. EMDR is a psychotherapy treatment designed to alleviate the distress associated with traumatic memories. It involves recalling trauma-related imagery while receiving bilateral sensory input, such as side-to-side eye movements. This process helps the brain reprocess the traumatic memories, reducing their lingering effects and allowing individuals to develop more adaptive coping mechanisms. Other treatments include cognitive behavioral therapy, CBT, which helps individuals change negative thought patterns and behaviors, and medications such as antidepressants or anti-anxiety drugs. It's important to remember that what works for one person may not work for another, and it's crucial to work with a healthcare professional to develop a tailored treatment plan. Together, we can break the stigma surrounding mental health and create a world where everyone feels supported and understood. So let's start a conversation about PTSD and work towards a brighter future. Remember, it's okay not to be okay, and it's okay to ask for help. If you or someone you know is struggling with PTSD or any other mental health condition, please seek help from a medical professional or a trusted individual. Thank you for watching and for being a part of this important conversation. If you found value in this video, please give this video a thumbs up and subscribe to our channel. Also, if you have any questions or thoughts, please leave them in the comments below. We'd love to hear from you and continue this important conversation. Thanks so much for being a part of our community, and thanks for watching.